Hello and welcome to Aston Originals for another episode of Health Matters. We are here today to celebrate 20 years of the Department of Audiology and Healthcare Science at Aston University. I'm Helen, I'm a Press and Communications Manager here at Aston, and I'm here with two of the audiology faculty members to talk about some of the work they do and what goes on at audiology here at Aston. I'll let them introduce themselves and tell you a bit about what they do. Helen, would you like to go first?
Yeah, sure. So I'm Helen Pryce, and I'm a reader in audiology here in the Department of Audiology. And yeah, I teach and I do research across a range of different topic areas within the subject.
And Amanda?
Hi, I'm Amanda Hall. I'm Senior Lecturer in Audiology here. So I'm a paediatric audiologist clinically, and I do teaching and research at Aston here, specialising in research teaching and also paediatric audiology, which is my clinical interest.
Aston University recruited the first cohort of audiology students in 2003. It was one of the very first NHS-funded programmes at universities in the UK. The four-year BSc honours course in audiology saw students spend their third year in placement within the NHS, and they graduated in 2007. We actually have a photo, hopefully coming up on screen, of the very first cohort to show you. Interesting to see the fashions of 20 years ago. They actually look not that dissimilar from nowadays. It's quite funny to see them all coming back round. There's lots of milestones for Aston University. So obviously the first graduates were in 2007. The first hearing aid dispensers course was started in 2007. What else happened? 2011, they started the STP program. Could one of you tell me a little bit about what an STP program is?
Yeah, so an STP program is a master's degree program in neurosensory sciences, and we have three different clinical disciplines who share common training across neurosensory sciences. So we have a neurophysiology component to that, we have a vision sciences component, and we have an audiology component. And we've been involved in developing different aspects of the teaching across that program for all of those disciplines, and there's a lot of common factors that they share. And we supervise and support, and in Amanda's case, develop some really brilliant training in research methods for those cohorts as well. So we lead them into becoming the kind of research active hearing scientists also, but healthcare scientists more broadly.
Yes.
Across all of those disciplines. So that means they're working in things like, testing nerve responses for the neurophysiologists. They get to work with all sorts of interesting clinical problems. The vision scientists similarly work with lots of interesting kind of visual disorders, and we get to learn all about that. And the hearing side, obviously, we know a little bit more about from our clinical backgrounds, but we get to work in all sorts of interesting problems, really, and conundrums that clinicians face in their audiology work, and our students find solutions to those problems, which is really exciting.
Yeah, brilliant. So that was 2011. So 2013, the MSc Neurophysiology practice was developed by the audiology team. In 2014, MSc Hearing Therapy came into existence. In 2018, BSc Audiology degree apprenticeship started. Does anybody know anything about the degree apprenticeships and what one of those is?
Well, these are students who are working, so they're employed by their NHS trusts, and they come and do distance learning with us at Aston. So they're mainly patient-facing in hospitals, and then they come to Aston to do their academic training. So it's a way of learning on the job, if you like, and a really nice experience because they're able to bring their patient experience with them to the university, and the teaching is meaningful to them from day one.
Brilliant. Yep. What's next on the timeline? I've got 2022. We started a Specsavers patient clinic on campus to help train BSc Healthcare Science audiology students. And now in 2023, we have the highest ever number of first years recruited on BSc Healthcare Audiology. Apparently 37 began. So that's pretty good. And in 2024, the next level 5 degree apprenticeship will start. So we're doing all right here.
Mm-hmm.
I've got a whole list of questions to ask you about lots of things that go on in audiology. So let's start with a general question to both of you. What made you want to join this department? There must be something exciting about it that made you leave where you were before and come and start at Aston University.
Well, both Amanda and I came from the University of Bristol, where we'd both been working on similar programmes there. So they also had bachelor's level courses and master's level courses that we were involved in there. But one of the exciting things about Aston was that it has a really specifically applied focus to its work and to its research. And that was really exciting for us because it meant that a lot of our research interests could be translated into teaching in a very straightforward way, because there was a clear application. As you've just described from the list of programs, you'll see this evidence of application in practice all the time throughout all of those different kind of programs. And it also gave us the opportunity to develop new programs. So I was behind the development of the hearing therapy program that you mentioned. And hearing therapists are a distinct branch of audiology who are primarily focused on the rehabilitation and psychological and social support of people who are affected by all sorts of hearing and balance problems, from people who have non-measurable but experiences of hearing loss right the way through to people who are profoundly deaf and might use sign language as their first language, and people with balance problems, and people with auditory perceptual problems like tinnitus as well thrown in there. So all sorts of interesting kind of human experiences and problems that we get to deal with there. And Aston's always been receptive to that. It's a university that has been interested in application to practice, and therefore it's really lined up nicely with our kind of principal interests and research interests in particular.
Great. What do you think is it that specifically makes Aston Audiology sort of different, unique, or special? Is it just that application?
Well, I think from the first we are teaching, we're involved in students from apprenticeship level right the way up to professional doctorate and PhD. So we teach, we're involved in students across the whole spectrum of learning, which makes it very special in that regard. But also I think the applied end, the fact that Aston values and the department values and works on clinical experiences, patient experiences, really from taking research findings and being interested and valuing how you can implement findings into the clinic and how you can make an improvement to patients on the ground in the clinic, really sort of directly applicable to what we're teaching the students. So there's a really nice blend of research and teaching. What we're researching, we can directly take into teaching. So I think that's what I really love about Aston and working at Aston, that approach and those values.
Brilliant. In terms of research, how about you tell us now a little bit about what exactly it is you do, what goes on at Aston Audiology, and all the kind of exciting things that's happened over the past 20 years?
So, well, we do lots of different things as part of our kind of research lives, and we run projects. Both of us employ people on those projects to work with us for periods of time. We do lots and lots of collaboration with both other academic colleagues within the organisation. So pretty much all of the work I've ever done here at Aston has also involved some of our colleagues over in psychology, for instance, who share quite a kind of common focus. But we also work closely with NHS trusts around the UK and involve them in our work. So they tend to be partners on all of our projects with us. We have lay members of the public who also partner with us and advise us on the work we're doing and contribute to the way in which we design and develop our research methods and implement those research methods with potential participants. And then we are supervising and supporting students at different stages, at master's stage, bachelor stage, and obviously at doctoral stages as well in their own projects. So we're sort of scaffolding students through understanding what constitutes health research specifically, and health service research, and then guiding them in terms of their the development of their project ideas and the specific activities they undertake as part of that. And then obviously we join them in writing up their publications at the end. So our master students in particular will publish every year, and our doctoral students obviously will publish from the work that they're doing. And obviously we support support them in achieving those goals. So it's really exciting to be able to provide, again, applied clinicians with an opportunity to sort of move their careers into another dimension. Should they be interested in academia, they can follow an academic pathway as a result of what they've done during their time with us. And that's something I'm really, really proud of.
What about you, Amanda? What sort of research do you think has been most important for you here?
Well, I think the fact that I have a small clinical role, so I work clinically once a week in Bristol Children's Hearing Centre, and I think being able to see do my clinics, see what the clinical problems are, and then being able to translate that into research questions and then work with the team to be able to then answer those questions and then hopefully take them back into clinic. It's that sort of research that's been really valuable. So things that can directly improve my job and patients' lives and the children that I see in clinic has been that's been the best thing, really.
What sorts of research questions does this throw up? You mentioned a few there. So what kind of specifics does that sort of throw up?
So Helen and I are working on a project at the moment with colleagues in UCL and at Oxford University NHS Trust on particularly looking at a type of hearing loss that we identify from newborn stage called mild hearing loss and unilateral hearing loss. So that's hearing loss that is either in one ear or hearing loss that in audiology we call mild, but that doesn't necessarily really reflect the experience of having that hearing loss. But it's a type of hearing loss that as an audiologist, we don't necessarily have the best evidence. There isn't the evidence out there as to how to help those babies that we identify and how to advise families. So Helen and I have been working on a project where we're trying to understand what it's like as a parent to be told that your child has this type of hearing loss, with all the uncertainties and ambiguities that come with that, because like I say, we don't really know how to advise families and what's the best interventions. And we're working on developing some resources to support families and support clinicians to be able to improve ultimately the outcomes for those children, but also to help parents during those early years when they have a small baby with this type of hearing loss that really nobody's not quite sure what to do and how to help best. So that's the sort of project that I really love, because I know we're working on something that's going to be really helpful, directly helpful, hopefully in 6 months or so once we finish the project.
You have to let me know so I can write a press release on that.
Absolutely.
And that, of course, is a great example of all the applied things that you were talking about earlier. Are there any other great examples of kind of applied research that have come out of audiology?
I mean, I think we've done a couple of things. And I do think that's very much our kind of contribution to the field of audiology, sort of academically, really, because I think what we've been particularly strong on is finding ways to examine and identify patient experiences of what it's like to be an audiology patient and to undertake sort of treatments. And we've from that developed interventions and tools that have facilitated a better experience for patients. So we've worked in things like tinnitus care decision aid we produced, which is the first sort of international decision aid. It's developed to international decision aid standards. Right. And we worked internationally actually on that one with a team of people from the US, and produced a tool that's now been taken up and used in the UK in clinical practice and in teaching, but also internationally. So it's used across the globe wherever people are working with people with tinnitus, to help people to identify what their preferences are for their treatments and to help them to choose between them. And that's been really important. Currently, we're working with the National Institute of Health and Care Research on a project to produce the first tool to measure people's experience of having hearing loss and people's experience of audiology treatment. And we've got sort of lots of measures already around people's outcomes as a result of audiology treatment, but we don't really know what it's like for patients going through that. So this is where our work currently is, and we're looking at finding ways to develop a tool to capture that in routine audiology practice. So again, absolutely at that kind of coal face, kind of thing, the cutting edge between patient and clinician. That's where we do our work.
Brilliant. You talked a bit in a previous conversation about sort of postgrad teaching and the kind of things you do there. This is obviously quite a big thing about what goes on at audiology in Aston. So what can you tell me about that side of things?
Sure. So, I mean, so the hearing therapy students that we take are people who are either coming from an audiology background, principally coming from an audiology background, but not exclusively. So we take people who are ready to study at postgraduate level, but have an interest in audiology, maybe some experience of it, not necessarily previously as audiologists. And they come and train with us about how to counsel and work with people in terms of a psychotherapeutic approach, how to manage conditions like tinnitus, vestibular disorder, and obviously different types of hearing loss. And then as part of their third year work, they will design and develop projects that are specifically relevant to their own circumstances and their own clinical departments. So one of our strengths, I think, across both the clinical science training that we do and also the hearing therapy training that we do is we really allow students to explore topics that are of interest to them and relevant to them in their clinical workplaces. So we allow people to think about what kind of unanswered questions they have. So we've looked at things like, why is it that if there's no decent evidence, to suggest that it changes the way someone hears their tinnitus, do people like using things like white noise generators, which are little devices that release a sound that someone can use to kind of manage or control their reaction to their tinnitus?
Yeah.
And sort of, why should that work if technically it's not achieving a result on that particular outcome measure? Well, we found out why. It's to do with control and to do with the fact that having a sense of controlling your environment is really important when you don't have a sense of control over your own tinnitus. And then it's things like, I don't know, what is important to people who are experiencing are profoundly deaf and have the opportunity to undertake cochlear implantation. So if you're an adult and you're deaf enough, you could receive an implant, which is surgery and is going to involve quite a bit of rehabilitation. What is it that helps you to decide whether or not you're going to choose to pursue an implant? So, right. I mean, those are two examples I can think of. Can you think of some?
I knew this was coming. My brain was like, remember some projects. I'm just, I mean, and students use a range of different research approaches depending on the question. So obviously we've come out of a pandemic and everybody was interested in COVID and hearing loss. And that was one of the key questions. So we had a student who did a systematic review. So she pulled together, scoping review, actually, she pulled together all the literature that had been written around COVID and the impact on the hearing system, and was COVID causing hearing difficulties and hearing loss. And she did a great piece of work pulling all that together and actually identified that the evidence wasn't very strong, and actually it didn't appear that there was an impact, and research continues to come on that question. But she did for example, a really good job pulling that together and synthesizing and trying to look at quite a big body of literature. How much people were publishing on COVID, and there was a lot of research activity on that. So that's another example of the sort of projects to be able to then go back to her clinic and say, actually, we can now advise patients. This is the advice we can tell patients about the current research.
Yeah. And that's a great bit, I suppose, of reactive research as well. This
absolutely.
is happening now. Let's have a look at it.
Let's do this and let's answer it.
Brilliant. What do you think is coming next for Aston Audiology? We've had 20 years of quite a lot of good things going on that maybe people didn't know about. What do you think is going to be the next big thing?
God,
that's a hard one, isn't it? That was quite a mean one to sneak in there.
I mean, we're growing as a team, and I think so. The amount of work that we're doing and the amount of work we're doing in this area is developing all the time and speeding up all the time, I think. So we've got colleagues who are working on gosh, we're working on tinnitus, we're working on suicidality and tinnitus, and trying to identify risks. We're working on burden on carers who might be living with somebody with hearing loss, and how does it affect them if you're having to always be the one to get up for the doorbell or answer the phone, and you're always the one who's having to cue somebody in a social situation. What does that mean for you? So there's lots and lots and lots and lots of questions all the time coming through. I think what's exciting is the output that Amanda was talking about in terms of the kind of slightly more creative or original tools to bring about change. So we're looking at the use of podcasting, for instance, potentially to improve health literacy, things like that, to get messages out to people who are affected. All sorts of different sort of strands of work really going on there, and I think probably lots of collaboration. I think that's really important for us, and that will continue. So we build relationships with audiology departments and with people who are running audiology departments, and they both work with us in terms of giving us access to people to work with in terms of researching, but also then implement changes that we have identified into their practice, so that we can see a real impact and a real shift as a result of what we do. So I think that's probably where we're going.
The area I see us developing further is actually that implementation. It's all very well coming up with something in a journal article, but actually, can we make a change in practice? What difference does that make to patients? What difference does that make to clinical practice? And if it's not making a difference, and we might have theorized that it's going to be wonderful, and actually if it's not making a difference in practice, well, why is that? What's happening? And really sort of understanding that complexity and the nitty gritty of what goes on in a clinic between a clinician and patient and family, to try to improve things. Ultimately, that's what we want to make stuff better.
I think what I'm getting from this is that everything's very much sort of patient focused, and making things better for patients, not just about teaching the students and making sure that they're coming out as competent practitioners, but making sure that everything's working towards the good for the patients as well.
Absolutely. And I think that's in a way an easy sell, because most of our students come to us because they have a strong drive to want to do something and make something better. And I hope that what we do is give them the tools and show them opportunities by which they can achieve that, so that we get some really exciting people who emerge from our programs and do really important things in our field.
Is there one thing that you think people should know about audiology at Aston University?
I think I'm really proud of the fact that we are the department in the whole of the country who provides the broadest range of training. And I think that's really important. I think we're really special in that we absolutely integrate research and teaching together. And I know a lot of people talk about that, but it's often not the case that it's absolutely delivered. But the nature of our research is such that students can really engage with it, because it's talking about the stuff that they're going to do, not the stuff they're going to do when they're senior or when they're researchers themselves, but the stuff they're going to do tomorrow when they go back into practice, So I'm really, really proud of those elements of what we do at Aston. I think that's really special. You got anything to add?
I got one thing.
One thing.
I can't pick a one thing. I suppose the thing that I'm really keen on developing and been trying to improve and trying to sort of develop resources and is around that research teaching that can be taken back into the clinic by students. So developing those research skills, making from being able to read a paper and understand what's going on in the paper to be able to then change practice. It's also, I think it's really important for patients to have access to research. If they're an NHS patient, all patients should have that opportunity. If there's research available to take part, that's beneficial for patients. It's beneficial for healthcare delivery. So to be able to, I don't know if I've managed this, but I would really like to think that students can see the value in research, and even if they don't take research themselves into their practice, that they are able to then offer those opportunities to their patients and be able to advocate for research and quality improvement. Research is broader than it covers a broad raft of activities, and be able to advocate for their patients to have access to research. So that's my answer to that question. I don't know if I quite answer your question, but that's something that's important.
Well, that reminds me of something else I think that we really are excellent in, which is I think we are good at using multidisciplinary approaches to audiology. So we're not just focused on hearing science, we're focused on hearing science and implementation science and psychology and all of the other kind of components that come together. So a lot of our work is slightly broader, I think, in terms of its scope, because we bring in different fields of health service research into our research
that's a good one.
Plans and delivery.
Great.
Jack of all trades.
I think that's a great way to finish up. Actually, it's a good thing to be so broad, and there's a whole ethos of creating rounded practitioners, rounded researchers,
contributions from other disciplines and fields.
Exactly.
And, having a wider view, wider lens.
Brilliant. Well, I think that's a good place to wrap it up there. Thank you very much for joining me, and thank you to the listeners for joining us for this special podcast. If you want to find out more about the department and its courses, you can visit the website. We hope you join us for another Aston Originals podcast soon.